So the prince of ignorant bro science, Joe Rogan, is taking horse dewormer for coronavirus. Let's take a look, shall we?
Joe Rogan has just disclosed that he has tested positive for coronavirus. In fact, he disclosed it in an Instagram video. Let's hear what he had to say.
Got tested, and turns out I got COVID. So we immediately threw the kitchen sink at it. All kinds of meds, monoclonal antibodies, ivermectin, Z-Pak, prednisone, everything.
Damn, over medicate much?
I guess I assumed that he wasn't a complete lost cause, but I'm wrong. Instead, he opted to self-medicate with roundworm medication.
Among other things.
If he's got roundworm, if he's got tapeworm, don't worry, your intestinal tract will be A-okay with that ivermectin.
You can pick that stuff up in public gyms. So look, some of the stuff he was talking about there is actual medicine. He was talking about, I think he was referring there to Regeneron, which is incredibly expensive. Most of his viewers wouldn't be able to afford it, but that's actually a treatment that has been demonstrated to help if you get COVID. It's no reason not to get the vaccine. You should definitely get the vaccine, but that's actual medicine. And then he took other stuff too that has not been shown to actually help. And so he's taken actual medicine and not medicine. We will see what narrative comes out of this experience.
You know, there have been cases of people who took high doses of ivermectin because they were unfortunately misled by people who have influence in society. And they were essentially defecating the lining of their intestines and thought that they actually ended up like, oh no, it turns out I did have some sort of parasitic infection. No, it's not, they're not worms. It was the lining of your intestines. Some people are crapping themselves, possibly to death, okay, because of this disinformation.
Here's an example of some of the misinformation she's talking about.
We know that our FDA has in many ways failed us by not allowing for the use of ivermectin and hydroxychloroquine, both of which are used around the world to reduce COVID hospitalizations and deaths.
Yeah, whatever you say there, horseface.
Pelted them with questions about COVID-19 and the vaccine and therapeutics, hydroxychloroquine, ivermectin, as well as other proactive treatments and practices were already helping COVID-19 patients all across the country.
On June 5th, Weinstein discussed the benefits of a drug called ivermectin, which can and is around the world used to treat and prevent the spread of the coronavirus.
See what I mean? Just absolute bullshit. There's no place in the world that these drugs are being used to treat coronavirus.
So America's Frontline Doctors, this organization that's been pushing ivermectin, they're hucksters. Look, Joe Rogan clearly has been misled himself, right? So I don't want to I don't put him in the same category as people who are intentionally lying to people because they're making money off of it. And by the way, Rogan likes to research, so research them. What they're doing is pushing ivermectin, then Americans go to their website looking to get a prescription for it, and what they do is they redirect Americans to a different telemedicine website that charges a fee of $60, right? To see a doctor through telemedicine and to get a prescription. The thing is though, America's Frontline Doctors charge a fee of $90 before they redirect people.
Jeez.
So they're making $30, they're pocketing $30 off this grift every single time.
Yeah, okay, well, so that's, obviously underhanded. At least they're getting a human prescription for it, rather than taking the sheep thing and cutting off little bits and eating it. Or I read posts where they're starting to rub it into their armpits now, which I guess is preferable to eating it. So that's fine. Yeah, and by the way, so this group that you're referencing, they're sort of directly making money off of pushing ivermectin. No, we referenced other people making money off of it. How? They're not selling ivermectin on their website, but what they are selling is a get out of critical thought free card to their audience. If you're trying to appeal to a lizard-brained right-wing audience, telling them, just get the vaccine, you idiot. It's not sheep meds that you need. They're gone. It's scary, I guess, to tell people responsible medical information when audiences can be so flighty around that stuff. But by the way, I will say for him, I'm not particularly invested in Joe Rogan. I try to avoid thinking about it, but I hope that he gets through with a very easy case. More importantly, I hope that he doesn't expose anyone else to COVID. And more importantly than that, I hope that after he gets over this, which he almost certainly will, he comes out of it with some sort of renewed sense of the need to be responsible about this. That he doesn't come out telling people that, like, sure, I took the really expensive Dr. Johnny Bananas monkey meds and ivermectin. It was probably the ivermectin that saved me, not the $1,500 a dose monoclonal antibodies that they cooked up in some underground lab. Like, just be responsible. Like, first of all, tell them, don't go through what I went through because you definitely can't afford the special monkey meds I got. So get the vaccine, which is free. But if you're gonna get it, don't rely on the essing out your intestine stuff.
Yep.
So we'll see. I don't have high hopes.
Yeah, defecating. That's the classy way of saying crapping. I see Joe Rogan, I've never said this publicly, I'm gonna say it for the first time publicly, and he'll probably hate me for this, but it is what it is. I see him as like an impressionable child.
I couldn't agree with Anna more.
So it depends on who he's talking to on his podcast on any given day.
70% of poison control calls in the state of Mississippi now are about people taking this drug, ivermectin, that they're buying at agricultural feed stores. They're taking a livestock formulation of it because, hey, Fox News didn't warn them not to do that. Here's the state health officer of Mississippi today, exasperated, having to try to talk people out of even this.
Please work with your doctor. This is medical treatment. You wouldn't get your chemotherapy at a feed store. I mean, you wouldn't get treat your pneumonia with your animal's medication. It can be dangerous to get the wrong doses of medication, especially for something that's meant for a horse or a cow.
As we pointed out last night, there are fully credentialed doctors out there currently prescribing a deworming medication to COVID patients. There were nearly 90,000 prescriptions a week for ivermectin from retail pharmacies by the middle of last month. You can see it's exploding as the Delta variant spreads. And that's even though the FDA says there's no clear evidence or data it is effective at treating COVID. Last night, we asked why professional medical groups weren't doing more to police their members who are pushing the drug. And tonight, the largest medical association in the country, the American Medical Association, along with the American Pharmacists and the American Society of Health System Pharmacists, just issued a new statement calling for, quote, an immediate end to prescribing, dispensing, and use of ivermectin to prevent or treat COVID-19 outside clinical trials.
So the moral of the story here is don't take ivermectin unless you have roundworms and you really need to get rid of them. But let me know what you think in the comments. Till next time, this is Brian Schultz. You take care.